Health system caring in the Valley. I'm your host, Patty Powers. We will be talking about two very different topics today, allergies and arthritis. In the first portion of our program, we will be talking about allergies, primarily in children, with Dr. Sam Pejham. Thank you for joining us.
Thank you very much.
To start, I would just like to ask about the different types of allergies that exist.
Well, actually, there are two types of, mainly as far as the allergens are concerned, we have to talk about what allergens are. They are mainly harmless particles for most people, but there are those who actually are sensitive to those particles. And mainly they're the indoor allergens, such as dust and molds that a lot of people are exposed to. And then there are, of course, the types of foods and medicines that people take, so the ones that they ingest and that could be an allergen. And of course, there are the outdoor allergies that a lot of people are exposed to when they walk outside the doors, such as the pollen and ragweed and mosquito bites that they may be exposed to, and they may have an excessive reaction to it. But it's basically harmless particles that a lot of people don't respond to them, but then again, there are those people that are sensitive to them.
Okay, so those people have those allergies. They're the ones that have issues. What's physically happening to someone's body when they're responding to these allergens?
So allergens are basically these particles. When they enter the body, your immune system looks at it and they think these are invading organisms that are attacking the immune system. And there's an immune response to it, like a false alarm, basically. And there are these tiny little immunoglobulins. They're called IgEs.
Wait, say that word again?
The immunoglobulins.
I haven't heard that word before.
They're little antibodies that start attacking those particles. And they're specifically for allergens called IgEs. And these IgEs bind to the allergen, and they end up activating these special cells called mast cells in the immune system. And what mast cells start secreting after that activation are a lot of chemicals, one of which is histamines. A lot of people may notice that because a lot of medications work against that specific medicine.
Antihistamines.
Right.
Okay.
So that's just one chemical among a lot of other ones that are secreted because of this activation. And what histamines and other chemicals will do will cause a lot of inflammation, itchiness of the skin. It causes runny nose, itchy, watery eyes a lot of people experience. And if they happen in your intestinal system, causes a lot of cramping, abdominal pain, maybe even diarrhea.
Wow, all these things from allergies. Now, can you separate, please, the reactions in food allergies versus the reactions from outdoor allergies?
Right. Well, outdoor allergies, like pollens, for example, will really affect your upper respiratory symptoms, such as your nose and your throat, maybe your eyes, as the particles enter your system in that direction. Food allergies, however, enter your intestines, and that reaction of the histamines and other chemicals that are produced happens in your GI system, and that's when you get all the cramping, diarrhea, and nausea, and sometimes even vomiting because of these chemicals.
That's a really violent reaction. Now, with the outdoor allergies, is there anything that can be done? I mean, people take medications and people take shots and things. Is there anything that can be done in the first place to prevent them?
Prevention of outdoor allergies is very difficult because a lot of times these things are seasonal. For example, during the spring season, that's where we're right now. The reason it's called the allergy season is mainly because the weather starts changing. Things are beautiful and blooming, and at the same time, all these flowers are releasing a lot of pollen in the air. And actually, sometimes the weather channels release pollen counts that are released daily. And certain days, when the pollen count is really high, it's best for people that are very sensitive to those to stay home. But other thing, short of that, it's just a matter of getting the right medicine and being treated for those symptoms. A lot of times these medications work as a preventive measure. So when you're in your system, they don't let the histamines work, or they don't let the mast cells start releasing those chemicals, and that way you don't even have the symptoms to begin with.
I see. Now, with outdoor allergies and with indoor allergies, you said you're kind of born with them. What about food allergies? Is there something that can be done to prevent those in the first place that parents can do for their babies, or are people born with them the same way?
Well, allergies in general is something you're born with. It's a part of your genetic makeup. So at some point it gets activated. Sometimes children start having it at a young age, sometimes adults have it later on. The genes are with you. It's a part of your DNA makeup. It's just a matter of sometimes they're not expressed until later in life. Once they're there, they're there. Now, children sometimes grow out of food allergies. It's been shown that sometimes if they're showed some allergies at less than 1 year of age, there is a good chance they may grow out of it later in life. But most adults, once they develop an allergy, it's with them for life.
For life. Now, with food allergies in children, you said sometimes they grow out of them. What types of things can children grow out of, and what